Hi friends, let's just continue the yesterday's topic, the last section's topic, what it is called as antidepressants. In this section, in the previous section, we were defining this antidepressants or the psychic illness disease where the symptoms are maybe hyper happiness, sadness, appetite loss, weight loss, making up pleasure less, what to the stimuli is less, we may not able to do it with much feeling, or to say the weight gain, and these are all different types of symptoms. But sometimes what happens, the over anxiety will also reduce us to the same action of depression. So this was the yesterday's definition what we are doing, and we finished about the mechanism of action, how it is performing by the neurotransmitters. We know that this depression is caused by 3 neurotransmitters and the other neurotransmitters in a lesser condition. So we can say that these are all inhibitors of monoamino oxidase enzyme inhibitors. We know that monoamino oxidase inhibitor enzyme, actually it is an enzyme which is used for the metabolism of norepinephrine, dopamine and 5-HT3. So these are the different types of neurotransmitters which have been disturbed by the enzyme's metabolism with MAO. So we can call these as biogenic amines constructing of inhibiting of this monoamino oxidase enzyme. So we can say that by blocking this particular enzyme, the metabolism can be stopped off so that the reuptake of the synthesis of the neurotransmitters can be enhanced and the percentage of neurotransmitter in the synaptical junction is increased. So today we'll see about the classification and mechanism of action and out of which is more potent out of it, and we'll finish off with the mechanism of action with one drug. So let me come to the classification. I've already finished my doing the classification over here. Just I'll give you the headlines over here. This is called classification of antidepressants. We know that it is being caused by serotonin. I told you yesterday serotonin is junction or a receptor which is present in medulla oblongata, which is synthesizing a neurotransmitter called as 5-HT3. This is also an autocoid also. So this can be inhibited so that your depression can be inhibited. So that is indicated in the name called as SSRI. So what it is inhibited, what it is telling? Selective serotonin reuptake inhibitors. So SSRI stands for selective serotonin reuptake inhibitors, out of which we have few examples for that. One is fluoxetine, which is one of the potent drug in this category, paroxetine, sertraline, fluvoxamine, fluoxetine, paroxetine, sertraline and fluvoxamine. This is fluvoxamine. Now we'll come to the second category. Here I indicated you the words, 2 words. These are called as SNRI inhibitors. So what it is indicating means serotonin norepinephrine reuptake inhibitors. So I'm repeating you once again the same word, SNRI. This is called as selective norepinephrine reuptake inhibitors, and this category is also called as atypical depressants, out of which this is a much more potent drug. What is that drug called? This is called as duloxetine. If you see the words here, it starts with xetine, etine, xetine. So we can understand that whenever a word ends with stine, that means we can categorize it as antidepressants. Now, duloxetine, milnacipran, venlafaxine. Duloxetine, milnacipran, venlafaxine. You can understand this. Sign, ein, time, ein. So you can understand the words. It ends with ein, right? And next, these come to the third category, As I told you, these are acted on MAO inhibitors. That means monoamino oxidase inhibitors, which are used for the cancelling of metabolism. So that category is always indicated over here. This can be indicated as MAOA inhibitors, or we can finally call it as MAOI. Now means MAOI means monoamino oxidase inhibitors, and out of which you have different examples. One is isocarboxazid, isocarbozazid, selegiline, this is important in this category, selegiline, phenylhexine, tranicypramine. I can give you once again: isocarboxazid, selegiline, phenylhexine, tranicypramine. So this is your third category. And next we'll come to the fourth category, what is called as TCAs. TCA stands for tricyclic amino functioning drugs. So what it is? TCA, which is a very important category in this antidepressants, where it is acting by different drugs, out of which desipramine, imipramine, desipramine, imipramine, and we'll go to aminotryptyline, clomipramine. You can understand the words ein, and ein. So what can I tell you? Desipramine, amitriptyline, clomipramazine, imipramine. So these are the different types of drugs which in this category. And now by these, seeing the understanding, it is very understand to easily mention you the mechanism of action. So let me come to this SSRI, called as fluoxetine, where it is called as selective serotonin reuptake inhibitors. How that means? It is acting on 5-HT3 neurons, which consists of 5-HT3 receptors on the postsynapse, and also it is acting on SRET transporter. SRET. We know that yesterday we were telling you about that SRET, serotonin reuptake transporter. Serotonin reuptake transporter, SRET. So these are the drugs which are blocking this transporter. So what it means, when you are blocking this transporter, the 100% what we are trying to take up the reuptake, the 100% of the neurotransmitter which is being released from the pre-neurons will be directly entered into the postsynapse on acting on 5-HT3. That means they are acting on serotonin receptors. Serotonin neurons. These are called serotonin receptors. So by this we can understand that fluoxetine is one of the drugs which belong to the category SSRI, is acting on serotonin neurons, blocking SRET, making the flow of neurotransmitter directly into the presynapse junction, synaptical junction, which is exciting the new two neurotransmitters on the postsynapse called as serotonin receptors for the flow of higher amount of neurotransmitter called as 5-HT3. Once the excitation is more, once the 5-HT3 is more, we can understand that the enhancement of neurotransmitter is been started and the depression it comes down to an activity where the neutralization happens, where the happiness or over sadness or the over anxiety can be neutralized and come to a stage so that the person becomes normal. So this is the mechanism of action of SSRI. So now we'll come to the next category, what is called as SNRI, and this out of which duloxetine is much important, and here these are also called as atypical depressants. So this is indicating you two words: serotonin, noradrenaline reuptake inhibitors. Serotonin, noradrenaline reuptake inhibitors, SNRI, out of which duloxetine is the best example. So by this we can understand that duloxetine is one of the drugs which is acting on two neurons, two presynaptic neurons. One is onto the serotonin neurons and the other one is, to keep a comma and give you, NA neurons, nothing but adrenergic neurons. So we can mention that it is not only blocking SRET, nothing but serotonin reuptake transporter, it is also blocking NET. That means it is blocking norepinephrine transporter. That means it is doing two activities at a time. So what is that activity? It is not only blocking your NET, nothing but norepinephrine transporter, and also SRET, nothing but serotonin reuptake transporter, so that the functioning of presynaptical junctions with NE, nothing but norepinephrine, and 5-HT3 are released in their own respective neurons into the presynaptical junctions, acting on their own respective postsynaptical junctions. Serotonin is acting on both 5-HT3 and NA are acting on alpha and beta respectively, so that the excitation is more, and the excitation of post neuron junction, the action of neurotransmitter at the synaptical junction is increased. By this we can understand that the action of depression is being lessened. So this is the action of duloxetine. This is called SNRI, and these are also called as atypical depressants. So this is the mechanism of action of another category. And next we will come to the MAOA inhibitors. These are also called as RMAI, reverse monoamino inhibitors, or MAOI, monoamino oxidase inhibitors. So these are also can be called in two ways, out of which selegiline is important. Actually this drug is not much more, and here I can give you one more example, what is called as mobiclamide. I can give you another exact sample which we always confront in the books, what is called as mobiclamide. It is mobiclamide, MOBICLAMIDE, mobiclamide. So this is one more best example in this category. One is selegiline, another one is mobiclamide. So it is clearly understood by the heading itself. It is called amino oxidase inhibitors. We know that this norepinephrine, dopamine and 5-HT3 are reuptake through the transporters for the metabolism activity by an enzyme called MAO. Nothing but monoamino oxidase, and this is converting itself into HVA, VMAT, this is homo vanillic acid. So different types of metabolic activities will be there. That is not much more important over here. Now only understand that this norepinephrine, dopamine and 5-HT3 are metabolized by an enzyme called as MAO. Now this metabolism has to be inhibited so that the transporter getting the 30% of your neurotransmitter is not metabolized and directly stored in the synaptical vesicles and enters into the presynaptical junction, and that is collected by the all the respective neurons, respective postsynaptical receptors, so that the excitation of that particular neuron will be increased or potentiated. So this is the action. So we can understand that this has to be blocked off. MAO should be blocked off. So this is your third category. And next we will come to the last category. This is called as TCA. Nothing but tricyclic amines. Out of which these are all best amines. They are all amines. You can understand here. Amine. So TCA, tricyclic amines. So this is a little bit best category, out of which all the antidepressants are mostly potently used by the the prescribers, the clinical manifestations, though it have lot of side effects and it cannot be combined with any other category of your antidepressants. So this has to be carefully and perfectly used so that the actions of antidepressants will come into action, and out of which desipramine and imipramine are the best examples. And here I can give you one more idea, that this imipramine is prescribed for the children who have the habit of bedwetting. We know that so the smaller children, more than 6 to 12 years, they have a habit of bedwetting onto the particularly the nocturnal time. So what happens, this type of imipramine is prescribed for the children so that the habit of depression will be controlled and your bedwetting is almost controlled. Now we'll come to see what is happens. As it is indicating tri, that means it is acting on 3 neurons. Tri, that you can remember that. So how it is acting? It is acting on 3 neurons. One is already we mentioned over here. I am erasing so that it is little bit empty for me. Okay. TCA, I told you it is acting on 3. One is 5-HT3, NE and DA, with little action on ACH and histamine. This is the reason why it have lots of side effects. As we know that more the action, more the side effects. So here we can see that this TCA is acting on 5-HT3, NE and DA. 5-HT3, NE norepinephrine, DA for dopamine. And these are also not acting on all the 3 types of neurons. It is also acting on ACH and histamine. This is the reason, as I told you, it has a lot of side effects. As it is acting on cholinergic system, we have all the effects, all the side effects which are related to cholinergic system can be seen over here. And also the histamine. We know that the histamines are the responsible autocoils for the allergy types. So that type of all the side effects will be confronted by this drug. So more the use, more the side effects, because it is acting on powerfully and potentiating on all the type of neurons. So 5-HT3 controlling your 5-HT3 neuron, it is blocking your SRET, It is controlling your MAO, it is controlling your NET, it is controlling your dopamine DAT, nothing but dopamine transporter. And you can see dopamine transporter is one of the best drug is buspirone. This is the best drug which is directly acting on dopamine rather acting on other neurotransmitters. So but as I'm not indicating this drug, just I'm giving you for an idea. So this is acting on all the type of 5 neurons or 5 neurotransmitters which are synthesized in the brain. One is 5-HT3, blocking your SRET, blocking your NET of NE, blocking your DAT, blocking of your MOA, blocking of your all the neurotransmitters which are present in pre-synapse. So the activity is more potentiated, and also as I told you, it consists of larger side effects and it cannot be mixed with any other drugs, and you should have a lot of interactions, and out of which they can, in the exam point of view, we can expect this question as write the mechanism of actions of TCA with a lot of ADRs or mention ADRs of TCA, that you can understand how I am going for the next section. So this is called mechanism of action, and now let me erase off you and depict you one drug aromatically so that you can understand and finish off. So I am erasing all these to make you an idea. I am keeping the picture as it is so that you can clearly tell me the points. So I am writing you imipramine, the best drug. So finish off like this. You can tell me it is acting on or acts on. So I clearly understood you about that. 5-HT3 NEDA neurons. If you want, you can mention pre-synapse. Right? Now you tell me what it is blocking. So you write the word here, blocks. So by this you can understand how it is blocking. So it is blocking SRET, nothing but serotonin reuptake enzyme transporter. NET stands for norepinephrine transporter. DAT, nothing but dopamine transporter. And in a large small actions, ACH and histamine. So by this action, what is happening? You finish off one more aromatically and write increases. Why? Because it is not decreasing, it is increasing. What it is increasing? It is increasing the action of NTs, nothing but neurotransmitters, all the 3, on post-synapse receptors. If you want, you can write in brackets what are the type of receptors. 5-HT3, alpha, beta, dopamine. So these are the 3 types of receptors it is acting. And finally we have to tell decreasing. So what it is decreasing? It is decreasing. I am cutting you over here. Metabolism of small words. All these are all small words. Metabolism of NAOA and NAOB. Finally come to the word anti-depressant, or you can write the word decreasing depression. Now this is the main aim of my pharmacological classes, pharmacology made easy. So this is the way how you need to represent each and mechanism of action so that the person who is been starting to listening to that or understanding that will be very easy for him, so that it can be remembered by the person, very small activity within 4 lines. So this is a way how we need to represent the mechanism of action. Imipramine is one of the best examples of TCA. If at all it is being asked as imipramine, we can finish off with imipramine. Otherwise, if they ask you as TCA, you keep the heading TCA, because the same are both are same. So you can't confuse, or you may not be confused. The word is simple, but the whole category belongs to the same action. So TCAs, write it as S apostrophe S, because it consists of all the drugs: imipramine, desipramine, amitriptyline. So you have different types of drugs. So TCAs acting on all the neurotransmitters, blocking the transporters, and also acting on ACH and histamines. It is increasing the actions of neurotransmitters on post-synapse receptors. That is the junction. You can write the word here also. If you want, you can finish up the word. Presynaptic junction. Write it as synaptical junction. If you want it more clear. Synaptical junction. Now it is decreasing. So what it is decreasing? It is the decreasing the metabolism of all the enzyme, particularly the biogenic amine, what is called as MAO and MAOB. And so finally, what is action needed? The action needed is antidepressants. And what is it? This is also can be called reduction of depression. That means whatever the symptoms are being symptomized, that are all being settled, like over hanginess, over sadness, over pleasure, feeling less pleasure, more appetite, more sleep, less sleep. These are all different types of symptoms I have already discussed in the last 2 videos. So this is a action how we need to represent in a aromatical way. That is a representation of pharmacological mechanism of action. That means our target of pharmacology made easy is being performed over here. And now we'll come to the last category. ADRs. We know that ADRs are more and more, as I told you, because it is acting on all the neurons. So come to the function. ADR, first we'll discuss about the side effects of ACH. Why? Because it is acting on cholinergic system. We know that the dry mouth, high appetite, a lot of side effects. Insomnia, higher weight gain, increase in postural gland, prostral gland, because it is an activity of cholinergic system. We know that it is acting on dysfunction of what you say is maldysfunction. So it is called prostate gland, because it is used in the lesser obturation. And you have sedation, dizziness, because sedation comes because of CNS activity, nausea, dizziness, as it is acting on CNS activity. More and more all the neurotransmitters are involved. So sedation, nausea, N stands for nausea, dizziness, insomnia, because lesser sleeper, sometimes weight gain, sometimes more appetite, sometimes dry mouth, higher sweating, which is an activity of cholinergic system, or we can call higher perspiration, and you have higher BP, sometimes which may lead to postural hypotension, sometimes postural hypotension. So these are different types of side effects. I can list you more, but this is quite enough. according to the knowledge what we are writing for the exam. So these are the different types of ADRs listed in a higher category. And one more histamine, you can write that also. Rashes, hypersensitivity. I can list you more if you want, or we can go through a book so that we can understand more and more. Seizures. But to remember, these are quite enough. And next we'll jump to, I'm erasing the mechanism of action because the space is not so enough for us to discuss about your IRs. Now we'll jump to IR. We know that IR stands for interactions through which cannot be mixed up. So TCA stands for whatever we are discussing now into phenytoin, one of your hypnotic drug which cannot be mixed. Why? Because it is replacing, because it is acting on your PPB, replacing PPB, that means plasma protein binding, and it is increasing its toxicity. So we can't mix the drug with phenytoin with TCAs. And next we'll go for TCAs into MAOI, nothing but monoamino inhibitors. Perfect. And this cannot be mixed, as I told you before itself. The combination cannot be tried. Why? Because it is increasing the metabolism. Perfect. Now we'll go for next one, TCA into alcohol. This we know that alcohol is one of the CNS depressant agent and we can't mix with everything. So the TCAs cannot accept with alcohol. So what happens? CNS depression will be enhanced. CNS depression is enhanced or increases. So these are the different types of interactions through which it cannot be combined. So these are different types of IRs. And now we'll come to the dose. Usually these are taken in the form of oral and perfect absorption is done, and particularly about 100 to 200 milligrams is available in the market in the form of tablets. Particularly they are suspension, what we can dispersion drugs, dispersion tablets. That means they are dissolved. So this is available in the form of oral drugs or tablets in the dosage of 100 to 200 milligrams in the market. So this is the TCA consolidation, TCA summative. If at all they could put forward you a question, write the mechanism of actions of TCAs with side effects, what is this involved. So you just list out of all these side effects, you finish off the mechanism aromatically